Welcome to my presentation on how I conducted a systematic review about the GI side effects of iron polymaltose complex compared to those of ferrous sulfate for pregnant women with iron deficiency anemia. This was the capstone assignment for a master's in applied nutrition from the University of New England. Today I'm going to give you some of the steps of how I carried out the systematic review process. Objectives. The objective of this review was to determine by systematically reviewing current literature whether anemic pregnant women can experience a significant difference in gastrointestinal side effects, particularly constipation, between taking either ferrous sulfate or iron polymaltose complex. A little bit of background about pregnant women, anemia, and supplements. Iron is vital for oxygen delivery throughout the body, and its need during pregnancy is greater due to an increased blood volume of the mother and the metabolic needs of the placenta and the fetus. Iron deficiency anemia poses a risk to the health of the pregnant mother and increases the chance of preterm labor, postpartum hemorrhage, preeclampsia, sepsis, and cardiac stress. It also creates many risks to the fetus by impairing oxygen delivery through the placenta, premature birth, low birth weight, and perinatal mortality. Ferrous sulfate is known as somewhat of a gold standard formulation when prescribing oral iron supplements and is the most frequently taken for iron deficiency anemia because it is effective and inexpensive. However, it can also be potentially toxic to the gastrointestinal mucosa, and many studies have shown that it is associated with higher incidence of GI side effects, such as constipation, nausea, vomiting, gastric irritation, and abdominal pain and discomfort. So, pregnant women are already more susceptible to constipation for many reasons that aren't even related to iron supplements. During pregnancy, there are anatomical changes in the GI tract, which slow down bowel transit time. This causes the intestines to absorb more water and consequently dry out stool. Iron polymaltose complex, or IPC, as I will be referring to it, is one of the many existing and safe, effective alternatives to ferrous sulfate, which has been linked to fewer adverse GI effects by other studies that had test subjects that were also men, non-pregnant women, and children. My study will specifically focus on pregnant women. Less side effects can also result in improved compliance with the intake of an iron supplement because there are less GI side effects, thus fewer interruptions of treatment. Methods of conducting this review involved searching a number of online databases, which look through clinical trials from peer-reviewed academic literature listed in this slide. Search terms involved iron deficiency anemia, pregnancy, the name of the two supplements, GI side effects, tolerability. Studies were selected and then screened using the Prisma 2020 flow diagram, which guided in sorting the studies that did and did not meet inclusion criteria. Subjects in all of the studies were pregnant women who were recruited from various medical centers within hospitals, like antenatal and perinatal clinics. Among the included papers in the systematic review, 5 were prospective, randomized, and controlled, which is ideal. 1 was just prospective and controlled. 1 was prospective and non-controlled, and 1 was retrospective. Data extraction. Once articles were chosen, extracted data was compiled in an evidence worksheet that was created by the Evidence Analysis Manual of the Academy of Nutrition and Dietetics. Evidence works each study's protocol, data collection techniques, study sample, statistical analyses, and summary of results. This information was then sorted into tables with fields that were most relevant to this review, such as author, year, location of study, study design, rating, study purpose and duration, population, intervention, GI side effects, compliance, and conclusions. The selected studies were also assessed and rated for quality and potential bias using the quality criteria checklist, or the QCC, from the Evidence Analysis Manual as well. The QCC is a rating system and risk of bias assessment tool designed to critically appraise the strength of evidence from the experimental trials included in the systematic review. Based on a variety of questions about relevance and validity, the QCC rates the study quality as positive, neutral, or negative. Characteristics of the included studies. Duration of the prospective studies typically ranged between 12 to 8 weeks, and the retrospective studies were 6 to 9 months. These time ranges in all of the studies were enough to produce desired and significant improvements in serum lab values that showed resolved iron deficiency anemia. All the studies except one involved patients who did have iron deficiency anemia. The one that didn't, they were taking it to prevent it. There were slightly different anemia qualifications or standards for levels of serum hemoglobin and ferritin. However, all those values fell within anemic standards of the World Health Organization. Supplement dosages of IPC were 100 milligrams, typically either at once a day or twice a day. One study administered it 3 times a day. Ferrous sulfate was typically 60 milligrams or 100 milligrams administered once a day or twice a day. Results. The primary indicators of interest in this review were adverse GI side effects with extra focus on constipation. Incidence of overall GI effects was significantly higher in the ferrous sulfate group compared to the IPC groups across all of the studies at a pretty high significant level, except, of course, the study without a control group. Constipation rates were also found to be significantly higher in patients who were taking ferrous sulfate. So all in all, constipation was noticeably lower in individuals taking IPC across all of the reviewed studies. Another indicator observed was patient compliance with the supplementation regimen. Studies tracked compliance by either collecting empty pill packets or unused pills, and by directly surveying the participants on their adherence to the treatment. Compliance was also found to be significantly higher in those taking IPC in all of the reviewed studies. Effectiveness of supplements was measured by serum lab markers and demonstrated by all 8 studies that both IPC and ferrous sulfate are effective at resolving anemia, which was just an additional perk. The conclusions. So the purpose of the systematic review was to determine whether pregnant women with iron deficiency anemia experienced a significant difference in gastrointestinal side effects when taking IPC instead of ferrous sulfate. Findings indeed suggest The IPC can be an excellent alternative iron supplement to ferrous sulfate for pregnant women to lessen the possibility of constipation and other unpleasant GI systems. This report supports IPC as a promising supplement for pregnant women to resolve iron deficiency anemia in a more pleasant way. Regarding the clinical impact, unfortunately, IPC is not sold in the United States, though it is a viable option in Asia, Middle East, Europe, and Australia. And all of the studies in this review were conducted in the Middle East, India, and South America, none in the United States. This, of course, slightly decreases clinical impact and relevance locally to people living in the United States. IPC is marketed in Australia as Maltifer or Ferrous and is manufactured by Vifor, a Swiss pharmaceutical company, and it's available without a prescription. However, in the United States, there is an existing but lesser known alternative to IPC, which is similar because it also consists of ferric iron bound to maltol. This product is called Acrufer, but does require a prescription. However, patients in the US can ask their doctor to prescribe it. So thank you so much to listening to my capstone presentation for the Master of Science in Nutrition degree from the University of New England.